How are minimally invasive hip replacements for osteoarthritis performed? Imagine getting a new hip with less pain and a quicker recovery. That's what minimally invasive hip replacement surgery aims to do. It's a modern approach that uses smaller cuts to fix the joint. Instead of one large cut, surgeons make 1 or 2 small incisions, usually between 3 and 6 inches long. Sometimes they use 2 tiny cuts, one near the front or groin and another near the back or buttock. This way, they can reach the hip joint without cutting through a lot of muscle or tissue. The patient is under general anesthesia, so they are completely asleep during the procedure. Once the surgeon makes the small incision, they carefully expose the hip joint with special tools designed for small spaces. They gently dislocate and remove the damaged femoral head, which is the ball part of the joint. The socket, called the acetabulum, is cleaned and prepared by removing the arthritic bone. Then, a new artificial socket, often made of metal and lined with plastic, ceramic, or metal, is placed into the pelvis. It is secured with screws or cement to keep it stable. Next, the surgeon shapes the upper part of the thigh bone, called the femur, to fit the new implant. They insert a metal stem into the hollow center of the femur, either by pressing it in or using cement. A new femoral head, made of metal or ceramic, is attached to the stem. The new ball is then placed into the socket, recreating the hip joint. Throughout the operation, the surgeon uses specialized instruments that work through the small incisions. Sometimes they use X-ray guidance to make sure everything is positioned perfectly. After the implants are in place, the muscles and tendons are repaired, and the incisions are closed with stitches or staples. Compared to traditional hip replacement, this minimally invasive method causes less damage to muscles and soft tissues. This means less pain after surgery and a faster return to normal activities. However, it requires a skilled surgeon because working through small cuts can be more challenging. It might not be suitable for everyone, especially those with severe arthritis, obesity, or complex hip anatomy. The goal of this surgery is to relieving the pain, stiffness, and limited movement caused by osteoarthritis. By replacing the worn-out joint surfaces with artificial parts while preserving as much tissue as possible, patients often experience quicker recovery and improved quality of life.